So over the last 24 hours, we've had 2 new cases, and we are currently tracking 44 cases across the country. We have 2 persons who are at the Ocean View Hospital, and but they're not in the ICU. They're just being observed, and the necessary care is being administered. So over the last 24 hours, or the previous 24 hours, we have administered about 200 doses. And this is for all the different vaccines and across the country. As you would recognize, that's not very high. And we want to really encourage persons who are older to get their vaccines, because once you're boosted, you'll be protected and we'll prevent the hospitalizations. While for quite some time now, we've not had any deaths, there are still people who from time to time can get severely ill, and those persons are predominantly older, persons with underlying illnesses such as diabetes or high blood pressure or heart disease and so forth. So if you have a pre-existing condition and you're older, it's best to come and get a booster dose. And for children, we do have the vaccines for 5 to 11, and therefore we want to encourage parents to make sure that their children are also vaccinated. So HPV is the abbreviation for human papilloma virus. And one way of preventing this disease is to be vaccinated. So you can have an HPV vaccine. Why this is important is that it was discovered that human papilloma viruses, they can actually cause different forms of cancers. So you have cervical cancers that HPV can cause, you have anal cancers, and you have oral cancers. So one way of preventing persons later in life from getting these cancers is to make sure that they're vaccinated. We have, among women in Guyana, cervical cancer is the second most prevalent cancer among women in Guyana. And we can prevent this by ensuring that all women in Guyana actually get vaccinated. So that's one of the reasons why we have this campaign to educate, especially young people, pertaining to HPV vaccination, what it can do, what it can prevent. And once persons get it, it would prevent them from getting these types of cancers. It's really age. So for different age groups, we have different dosages. So one of the things that we have been doing for persons 9 to 15 years of age, both male and female, we give a single dose vaccine. And these are the vaccine regimen is really based on what PAHO and WHO has been recommending. So for 9 to 15 age group, male and female, 1 dose. For persons between 10 to 18 years of age, we both male and female, there's also a 2-dose regimen. So when you get your first dose, 6 months after, you can get your second dose. For persons 19 to 45, and this is predominantly women, there's a 3-dose course. And first dose, then your second dose 1 month after, and then the third dose 6 months after the second dose. So this is something that we've been doing. And for immunocompromised people, we also do the 3-dose regimen. Now, there has been a change in this, what I just described, because previously we were only offering these vaccines for persons, both male and female, 9 to 15 years of age. But the new guidelines published by all the reputable organizations dealing with cervical cancer would have advised that we can go beyond 15 years of age. And that's why we have now updated our schedule to include persons beyond 15 years of age who can access the vaccines. Previously, a woman who was, say, 26 years of age could not have had access to these vaccines. So we have now expanded access to the vaccine. So with cervical cancer, especially, HPV plays a very pivotal role in prevention, and we really want people to ensure that they get vaccinated against these viruses.